Okay, let's talk about sequential extraction. There's actually a couple good teaching points here that will make you aware of some things you may hear outside that are actually not beneficial for you. And it's just a little bit of logic that can make you understand it. And sequential extraction is the core of this. Now, in the back of your head, there's a couple different types of hairs. And they come in different groupings. They come with 1 hair per graft, 2 hairs per graft, 3 hairs per graft, 4 hairs per graft. There also can be hairs that are thin and thick. So you can have a thin single hair graft, a thick single hair graft, and same thing with doubles or not. Now, all these grafts are different sizes. The thin single hair grafts are a little bit smaller than the thick single hair grafts, and then the doubles and the triples and the quadruples, right? So these are all different sizes of grafts. A lot of clinics will tell you, hey, we use a very, very, very small bit to remove our grafts. Okay, well, that's great. That small bit will get out the fine singles and maybe the thicker singles easier, but it'll be way too small for that 4 hair graft. So if you are claiming to use small bits, what's happening to the grafts that actually need that bigger bit to be taken out? And then also, if you are a team maybe having a less experienced technician, you use big bits. You won't mention the size, but you mentioned how the transaction rates are really low because you're using this big bit on this little hair that doesn't really need it. Now, this creates a problem when not taking out the hairs only, but also when they're implanted. Because when we're doing a hairline in particular, we want single hair grafts, and we want the fine single grafts, and then we also want the thicker single grafts. We don't want any doubles or triples quite yet. We want to use smaller bits to get those out. And why is that? Because if the hairs are not just hairs, there's actually tissues underneath. And depending on the size of that tissue, these hairs can only be placed so close together, right? So using smaller bits to get these tissues out, we can get these single hairs grafted closer together to achieve the density that we want, because by definition, they are low density grafts. In order to create a nice full hairline that's also feathered, you have to use more grafts. Going back to our graft count lead to more natural results. And now the ways to get these hairs out to increase that naturality and get them closer together. Please do not ever think that a small bit is the right bit to use. No, the right size bit is the right bit when it's meant for the right hair. And that's what sequential extraction is. We actually pre-calculate what types of hairs we want. Okay, how many hairs we create in the hairline? Usually a hairline requires 200 grafts per millimeter. So if we're creating a nice feathered hairline and we want 4 millimeters of feathered hairs, we want 800 grafts. Well, what we do is we go put on that bit first. We go get 800 single fine or maybe thick single hair grafts. And then we move on in sequence to the bigger bit to get the next size hairs, because remember, those are, even though we're getting them close together, there's going to be low density. After that 4 millimeters of feathering is created, we want to move to the double hair grafts, and using that small bit on the double hair grafts can cause them to strip or transect. That means a dead hair, a kinked hair, or a dry hair. We don't want that. Sequential extraction is the process of sequentially remove hairs to establish the natural result that we want in keeping hairs healthy. And the reason the cost is we have to use more bits, more time. We actually usually make not just one pass for all hairs, but usually 3 to 4 passes for the different hairs that we want, therefore increasing the cost a little bit and the need for this procedure.